I'm here in my office. It's quiet. There's nobody around. And I'm going to take this opportunity to share some of my thoughts on monitoring and evaluation with you. Let's start off by asking a simple question. Why monitor and evaluate? The reasons are numerous, and they are all critically important. We monitor and evaluate to learn what works and what does not, to make informed decisions regarding program operations and service delivery based on objective data. We monitor and evaluate to ensure effective and efficient use of resources, to keep our programs on track, to assess the extent to which a program is having its desired impact, to create transparency and foster public trust, to understand and support and meet donor needs, and to create institutional memory. We use several different synonyms for the word monitoring. In evaluation speak, we refer to monitoring as formative evaluation. Sometimes we call it process evaluation, because monitoring focuses on the implementation process and asks the key question, how well is our program being implemented? Monitoring is an ongoing, continuous process. It requires the collection of data at multiple points throughout the program cycle, including at the beginning to provide a baseline. It can be used to determine if activities need adjustment while the program is taking place, to improve outcomes, and to track changes in program performance over time. Monitoring provides information for stakeholders to make informed decisions regarding the effectiveness of programs and the efficient use of program resources. Here's a list of program elements that are commonly monitored. Supply inventories, the number of vaccine doses administered monthly, the quality of service, the coverage of services provided. It's a long list, but those are a few examples. Now let's talk a little bit about evaluation. Evaluation in M&E speak is often referred to as summative evaluation. Unlike monitoring, which occurs continuously, evaluations are less frequent, scheduled in advance, and seek to analyze the effectiveness, magnitude, and/or satisfaction of short and medium-term outcomes. An evaluation of a project should analyze the implementation process, as well as the impact that the project has had on health status of target populations. Evaluation asks questions like, to what extent did our program activities lead to our meeting our program objectives? To what extent can our outcomes be attributed to program objectives? What changes have occurred in the target population as a result of our program or project? How has our program or project or policies been conducted? What happened? What was accomplished? What was our level of effort? Operational issues are things that we have to confront when we monitor and evaluate. For monitoring, we have to think about what we're going to monitor, the purpose for monitoring what we have chosen to monitor, the frequency of data collection and reporting, the source of data, and we'll also have to identify who will get and use the monitoring information. For evaluation, we'll have to decide on the scale and focus of the evaluation. We'll have to name an evaluation team and decide when the evaluations will be done. We'll have to determine who will get the evaluation findings and how much the evaluation will cost, and we'll have to budget for that. And as an aside, generally you should figure somewhere between 5 and 7% of total project cost being spent on evaluation. Now this is a very critical slide because it comes from our logic model, and it explains the relationship between the logic model and the development of an M&E plan. And I'm just going to review this with you. I like this slide because it uses the logic model, which we spent a lot of time developing, to frame monitoring and evaluation questions. The diagram here separates the logic model into formative evaluation, which we've said is monitoring, and summative evaluation, which we refer to as evaluation. And for monitoring, we ask context questions about relationships and capacity. We ask questions like, what aspects of our situation most shaped our ability to do the work we set out to do in our project? We also ask implementation questions about the quality and quantity of the activities and outputs we have undertaken in our project. What did our program accomplish? For each of these monitoring questions, we then develop process indicators that are measures of whether planned activities are being carried out and how they are carried out. For the evaluation side, on the right side of this diagram, we ask questions about effectiveness, magnitude, and satisfaction. What is our assessment of what resulted from the work we did in our project? What have we learned about doing this kind of work in a community like ours? For these questions, we develop outcome indicators. Outcome indicators measure the quantity and quality of the results that we have achieved. One of the most critical steps in designing an M&E system is selecting appropriate indicators. The M&E plan should include descriptions of the indicators that will be used to monitor program implementation and evaluate achievement of the goals and objectives. As we have said, for monitoring, we generally use process indicators that are measures of whether planned activities are being carried out and how well they're being carried out. For evaluation, we use the outcome indicators that measure the quantity and quality of the results achieved. Our indicators should measure an important aspect of a program, should show whether project activities are on track with planned outputs, and provide benchmarks for demonstrating the achievements of the program. A reasonable guideline is to have 1 or 2 indicators per outcome, and at least 1 indicator for each output, but no more than 10 to 15 indicators for any significant program focus area. Now let's take a look at some types of indicators for each of the logic model components, starting with inputs. Here is a simplified logic model. The expected impact of the program described in this logic model is to decrease the unintended and mistimed pregnancies. And working from left to right and starting at inputs, we see that there are some resources that will be available to us as we start the project, both staff from the MOH for training and materials the MOH has developed for training. We see that if we have those materials, then we will be able to conduct family planning training workshops in all of the districts. And if we conduct those workshops, we will have trained clinic providers in family planning service provision. And if all the clinic providers have been trained in family planning service provision, then they will have increased knowledge and skills to deliver family planning services. And if they have those increased knowledge and skills, they will be able to provide quality counseling to every patient encounter. And if they provide quality counseling at every patient encounter, we will have improved access to quality family planning services. And if we have improved access to quality family planning services, we can imagine that the impact of that will eventually be a decrease in unintended and mistimed pregnancies. Now let's try to create an M&E question and an indicator for each of these logic model components. So what I'd like you to do is get out a pencil and paper or use your computer and take a look at the next slide and develop an M&E question and then an indicator for that question. I'll do the same, and then we'll compare notes. So here's the question. It relates to inputs, and the question is that you want to develop is what question do you want to ask to monitor these two inputs, the MOH training staff and the MOH training materials. And once you've asked those questions, create an indicator for each that will tell you whether you have answered that question when you get the data for that indicator. So pause the Camcast, write it down, and then restart the Camcast and we'll talk. Great. Well, here was my thought about this. The question I would ask about MOH training staff was, were MOH staff available to develop and lead the family planning training workshops? And the indicator would be the number of hours the MOH staff participating in developing and conducting training workshops over the projected number of hours required for development and implementation of the training workshops. For the second, we might ask the question, were MOH training materials available to training staff? And the indicator might be MOH training manuals were provided by the MOH at training workshops. And we could have the number of times those materials were provided over the number of training workshops that were delivered. So now we're going to move to the right of the logic model and look at asking questions for activities and participation, both components of output. So the first will concentrate on the output activity, which is conduct a family planning training workshops in all districts. So now put down your fork, push the pie away, get your computer out again, and develop a monitoring question for this output. Conduct family planning training workshops in all districts. And when you've done that, then do the participation question. What question would you ask to monitor whether all clinic providers trained in family planning service provision? And once you've created those questions come up with an indicator to measure each. So pause the tape, answer the question, and then come back. So here are my thoughts on those questions and the indicators associated with them. First, for outputs activities, the question I might ask would be, were training workshops conducted in all districts as planned? And the indicator might be the number of workshops conducted per district over the number of workshops planned per district. And for the participation component of output, all clinic providers trained in family planning service provision, I might ask the question, did we train all providers in district clinics in family planning service provision? And the indicator might be the number of providers completing training in district over the number of providers in the district. So now we've arrived at outcomes, and we're going to do short, medium, and long-term outcomes, and we'll start with the short-term outcomes. Our short-term outcome is increased practitioners with skills and knowledge in family planning service provision, and we're going to develop an evaluation question for this outcome, and then an indicator to assess this question. So again, take a sip of your eggnog and write down what you think, and then we'll compare. Pause the tape. Welcome back. So here are my thoughts for this question about assessing the practitioner's skills and knowledge in family planning service provision. I might ask, did practitioners' skills and knowledge about family planning increase? And my indicator is percentage of providers scoring 85% on a skills checklist 1 month after training. So now let's talk about medium-term outcomes. In this case, the medium-term outcome is family planning counseling is provided at every patient encounter. And the question that I might ask is, do patients have improved access to quality family planning service? And the indicator might be the number of patients receiving family planning counseling at each clinic visit by facility each month. Let's take a look at long-term outcomes. We're looking at improved access to quality family planning services. A question that I might ask is, are more patients receiving quality family planning services? And the indicator might be the number of patients who report that they have continuous access to their contraceptive choice. And finally, let's talk briefly about impact indicators. What question would you ask here? Well, my question was, have clients reduced unintended pregnancies? And the indicator would be the number of intended or mistimed pregnancies reported by clients over the total number of clients. So we've worked through that example of using the logic model to create evaluation questions for the different components of the model. We've completed our Camcast, and I think we've seen how we can use our logic model to develop our evaluation plan. We've seen how we can use the inputs and outputs, both activities and participants, to create monitoring questions and indicators related to those questions. And we've seen how we can evaluate the outcome of our project using short, medium, and long-term outcomes from our logic model. We ask questions about what the program has achieved, and we can develop indicators to help us assess those achievements. It's great to be sharing these thoughts with you today, and I hope you all have a happy Thanksgiving, and I'm looking forward to seeing you next week when we will tackle in class the development of a monitoring and evaluation plan for our projects. So long.